Thanks so much for the invitation to speak today. I work for the Centre for Oral Health Strategy in New South Wales Health. Really just wanted to share some resources that we've recently developed, primarily for carers of people with disability and how to improve their oral health. So just to begin, I'd just like to acknowledge the traditional custodians of the lands on which we meet today, many and varied. We honour the ancestors of yesterday, the custodians of today and those of tomorrow, and also their continuing connection to land and waters and how culture is held, nurtured and shared. And I certainly extend that respect to any Aboriginal or Torres Strait Islander people present here today. As I'm sure you're all aware, the National Roadmap for improving the health of people with intellectual disability, towards the end of last year, one of the main recommendations was to expand oral health promotion training to carers of adults with disability as a top priority. And that worked in really well with the work that I've been doing with a project group for the last 2 years. In March 2021, we identified, particularly for New South Wales Health, there was a real gap in oral health resources for carers of people with disability that really specifically spoke from the carer's viewpoint. So I conducted a scoping review to see whether there were any sort of similar resources, videos, and whether they existed. And can I just say at this point, so there's some beautiful materials from Victoria, particularly from Inclusion and Dental Health Services Vic. They've done some really lovely work in this space and really have been leading nationally, but still there was a gap. There wasn't anything specifically for carers and oral health. So we formed a project group, and that project group has some dental experts in special needs dentistry, paediatric dentistry, oral health promotion. We obviously had carers and we have other interested stakeholders. And in addition to the project group, we also had another separate carers reference group as well. It was decided that videos would be best, and together with some supporting print and downloadable materials. Now, our challenges were recruitment for families willing to be filmed, and obviously COVID as well played a big part in having us sort of delayed. So we've ended up with 2 videos. Initially we thought, oh, wouldn't it be nice if we had a video would be like 5 minutes long and we'd be able to cover everything. Well, that's impossible. So I think everybody really acknowledged the fact that for people with disability, there are many, many areas that need to be considered as far as keeping a person's mouth healthy and clean. And so we've ended up with 2 videos. The first video is 14 minutes long and it covers the following topics: routine, the importance of establishing a routine. That's what that means. Like how to brush, cleaning between the teeth, and the importance of sugar reduction. The second video is 11 minutes long, and that covers the dental visit, storyboarding, preparation for a general anaesthetic, people who are non-verbal, and some unique concerns for people with disability. And the idea with both of these videos is that people can just click on the topic that they're particularly interested in, or they can watch the whole thing through. It's our objective from day one was really not to be too prescriptive from the sort of dental expert point of view. So we have 3 wonderful carers, parents who are involved in these particular videos, and they've been great. So this is the link for the video.
A guide for carers. In this video, we cover the following topics: routine, brushing, cleaning between the teeth, and sugar reduction. Topic 1, routine.
So if I had to give advice to anyone who had a child with special needs about cleaning their teeth, I would try and start a routine: breakfast, dinner, we eat, and then we go into the bathroom and we clean our teeth.
The mouth is an important but sometimes forgotten part of the body, and good healthy teeth and mouth are incredibly important for communication, for speech, for swallow and for nutrition. Good oral health is really important for good overall health.
Getting a routine with it is really important. Like if I was to brush her teeth straight in the morning, I probably wouldn't get a good response because that's not what is normal for her.
Toothbrushing routine at night is always the last thing before going to bed. I always give her tablets and clean her teeth. That's our routine. Last thing at night. Now the trouble is where it is. It's often sitting here on the mat because she'll be watching TV.
Whichever location oral care is being performed in, whether that be in the bathroom or outside on the lounge while watching television, it's very important to have good lighting, adequate space. You may need to prepare for the brushing activity and have gloves, your toothbrush, a mouth prop if it's required, and the person with special needs or additional needs may require a mirror for visual feedback to see what's going on.
So I will explain what I'm doing as I'm going, and I'll ask, you know, can I please do this? Can I do that? Obviously with Victoria, she doesn't tell me no or yes, but she will pull away or she will make a face or anything like that. And obviously that's a sign to stop.
So sometimes when everything is getting too hard and there's hospital visits, multiple things going on, behavioural challenges, then self-care falls by the wayside. And particularly oral health and oral care gets neglected. In a group home setting, restrictive practice might mean that a person is seen to be refusing oral care, and so it is no longer attempted. It's very important that oral care is attempted daily, just the same as all other forms of self-care.
If, you know, for people that are busy and going to work, if you might miss in the morning, that's not such a big deal, provided you clean last thing at night. I think that's the most important thing.
If a person is only going to be able to brush once a day, then at night time, just before bed, is the best time to brush.
Topic 2, brushing.
We now brush after every time he eats, just with water. We'll rinse his mouth out, use the mouthwash once a day. I get Ben to brush his teeth before we brush his teeth. We're trying to get him to take over every step, but we've also got to make sure that we do it properly. But we never used to brush first and get the food off. We used to just go straight to the toothpaste. Ben always brushed first and then we brush second.
Some
That's probably
strategies
enough.
that can be used for...
Thanks, Nicole.
All right.
That's great. Can you just do the rest of my slides as well so that we don't have to worry? Thank
sure.
you.
That's all right.
So that gives you a bit of an idea. So that's just us filming. Ben and Angela, who were great. The families were fabulous, can I just say. They were so helpful and so lovely. What we've also done is we've developed a companion piece for these videos. This was what we initially had, which was a 2013 publication. Language was completely outdated. Some of the messages were outdated. The imagery was not good. So we've completely done that, and we've gone to this nice A5 publication, which I'm in the process almost ready to print now. So that's great, but it is on the website. So how to brush someone else's teeth. And we've, really, again, it's a little booklet. There's 12-page A5 booklet, but you can certainly print it out from the website. But as I say, our idea is that one that we're actually going to get printed will have a QR code on the back, which will actually link to the videos. So again, for carers of adults with disability, I think that could be a useful resource for them to have. We're also in the process of developing another video with children with disability and a guide for parents and carers. So we've really struggled with getting families over the last couple of years, but we've now filmed 3 families, and we'll have an expert person doing that as well, a lady called Dr. Melissa Warren. She's a paediatric dentist, and we'll also update the current booklet very similarly. So that's sort of in progress. Hopefully we'll have that by the end of the year. As well as that, we've also revisited a whole lot of our other sort of tip sheets, and in particular, we wanted to make sure that we had some easy read materials, because up until this point, as far as oral health and New South Wales government goes, we had no easy read resources available. So this is the denture care one, and we were very grateful to our friends at Dental Health Services Vic, because they had some really lovely infographics on how to brush your dentures, and so we were able to use those with permission, and we've just broken that down. And no, that's okay. And then the other one that we're doing is medications in your mouth, which we're at the moment, that's just awaiting final approval. So yeah, that's just by the by. Obviously, we're going to have a bit of a communications plan for this project. So really just to make sure that carers and other interested people have easy access to these resources. COS stands for Centre for Oral Health Strategy. So we want to sort of promote this quite widely. And clearly we want to do that to health professionals, dental professionals, and that'll be through conference presentations, webinars, to carers through New South Wales Health and Social Policy, NDIS providers, Carer Gateway, and hopefully through students, through inclusions of these materials to educational institutions, such as whether it's technical disability training courses for carers, or dental and oral health students through the relevant university courses. And this is just the project group, and they still are. They're terrific to work with. And as I say, we also had our carers reference group, and they've been completely such a valuable resource for us to be able to really get their input and their consultation. So that's pretty much it. So yeah, it was really just as an FYI to make you aware that these resources are now available. And as I say, I'll put both the links to the videos and the booklet in an email to Nicole and Kerry so that they can send them out. But hopefully you might find them useful.